Welcome to NP Launchpad, presented by Fitzgerald Health Education Associates, the podcast created for newly graduated nurse practitioners navigating the transition from school to clinical practice. Hosts Jason Gleason, Christopher Gleason, and Vanessa Pomarico-Danino deliver real talk, real experiences, and practical guidance to help you succeed from day one. So if you're ready, let's jump right in.
Hi, everyone, and welcome to this episode of NP Launchpad. Tonight, we are going to be talking about support staff expectations and delegation. And I'm once again joined by my co-host, Dr. Christopher Gleason and Dr. Jason Gleason. How you doing, guys?
Doing great. Thank you.
Doing great.
Awesome. So good to see you.
Good to see you.
So I just want to remind all of our listeners that if you have any questions for us, any comments, you can reach us at nplaunchpad@fhea.com. That's nplaunchpad@fhea.com. And please remember that these podcasts really serve for education only. Please verify any of this information with your particular state, your employer, or any payer rules that would be applicable to your particular area.
Yep.
So let's kick off the hot topic discussion.
All right, bring it on.
And I know that I always say this, and I say it with much love in my heart, that you two are the princes of the VA system.
Oh, you're sweet.
So
You
what
are the
should
queen
the
of
support...
healthcare everywhere.
Yes, you are.
Yes.
I don't know about that, but I go back to my office and I say, I don't know, my friends have an actual RN and an LPN working with them. Like, why can't we get one in this office? So what should support staff expect from the nurse practitioner, Jason? Let's start off with that. What should our support staff expect from the nurse practitioner?
You know, one of the biggest challenges I think new NPs, just new grads getting out of school, your first job are going to have is moving to that position where you're the leader of the team, right? And to recognize that because they're looking to you to be the leader. And many of these LPNs, RNs, medical technicians, whoever you're working with, your entire team, they've worked with other providers that have been the leader. So you got to kind of buck it up, walk into these clinics like you own the place because you do, but balance that with not having a crappy attitude. Like if you go in there with a big ego, you're going to get sunk right away. So recognizing that you're a leader, you're going to do great. You have all these skills and wonderful knowledge to share with anyone else. But I'll tell you what, it's not about just sharing your knowledge. It's about learning. I worked in an emergency department as an NP. And I learned the most, not from a physician, not from an NP colleague, but from an LPN that I worked with. Yeah, a lot of orthopedics. He taught me a ton of stuff that I didn't know. So you can always learn from anybody on your team, regardless of who they are, what their skills are. Take an opportunity. Be curious. Be curious about different roles. And then you will be loved and admired. And most of all, you'll be accepted as part of the team.
Absolutely.
Great points.
Yeah, thank you.
So Christopher, on the flip of that, what should the nurse practitioner expect from the team?
I think first off, especially when you're going into a new team, you need to establish clear delegation and clear responsibilities. Make sure that they know what they need to do or what you expect them to do. And what the NP should expect from the team is that they're going to be able to do their role and serve in that capacity. So if I'm delegating responsibilities to an LPN or an RN, then I'm trusting that they know what they're doing and that they're going to get the job done. And if you're finding that you're delegating these responsibilities and later on you're finding out that they're not done or they're done haphazardly, then that's really when you have to have that conversation with whoever and say I see that you're not quite getting the concept. So, because maybe it's education. Maybe you just need to educate them,
Right. You know what I love that you just said, though, is you got to talk with them about things when they're not meeting expectations. So much of the time, it's human nature. Like if somebody is not doing what they should be doing and you want them to do something differently, so much of the time, we go to their boss, right? And we have a discussion with their boss, and then their boss gets involved, and it's a bigger deal. And if it is a big deal like a safety issue, obviously you want to do that. But from day-to-day stuff, I'd say the petty stuff, don't get involved in that, but just go to the person and talk to them and say, hey, this is driving me bananas. Can you please do it this way? Or have you thought of this, right? And then tell them this. Say, you know what? If I ever do anything that drives you absolutely nuts and crazy, tell me. Tell me, because we're human beings. But communication, I think that's a lost art in so many of our experiences, and we're just likely to go to the top and report people and complain and whine. The other thing I would say too is if you're going to bring up an issue with somebody that you're working with, suggest some solutions to it too. Just don't tell them how
Absolutely.
negative it is. So
Yeah.
yeah, you could have a positive outcome from all that.
Absolutely. That's why the education part is
Absolutely.
great.
Yeah. Oh yeah.
So I think it's really important, especially when you're starting to work with new support staff, or if you're the new person on the job, that you look for job descriptions to see
Yep.
what is
Oh
within their
yeah.
job description,
Mhm.
because you guys work with nurses, we work with medical
Hmm.
assistants. So their job descriptions are going to be very different, and therefore my expectations have to shift, because
Yeah.
I'm not working with somebody that can, write orders and that
Hmm.
kind of thing.
Mhm.
So, looking at job descriptions, looking at workflows that have already been approved, looking at any of your escalation pathways. And those are the things that, as a new nurse practitioner, you need to know those things
Hmm.
going into the job. But also, too, how do you guys address we've always done it this way?
Oh boy, that's a tough one.
I don't know.
Jason.
I think that kind of goes along the line with what you're talking about with communication.
Hmm.
You can always have that conversation with them. I understand that you've always done it this way, but looking at a new approach, or trying to take this approach and melding it with your approach is not necessarily a bad idea.
Yeah.
You should
Right.
always be willing to learn. And you should always be willing to shift, because things are going to change.
Well, I think when you're faced with that too, when you go into a new place, you're so excited to share your knowledge and your
Mhm.
experience and your new ideas, because you're going to go in that place and turn it upside down and improve it, do 100,000% better, right? That's our goal. And it's not that you're a bad person or you're just self-centered or ego-driven. You just want to help, and you have all this great knowledge and enthusiasm to share. But if you walk into a situation where they say, "No, we've always done it this way, so we'll stick with this," how I would manage that is, you know what? I'm new to the team. I am in charge of the team as the provider, right? And it's your license that's on the
Mhm.
line, so you should be, because the buck stops with you. And you know what I
Mhm.
would tell those folks that push back and say, "Oh, we've always done it this way." You can say, "I am so interested in learning how you've always done it. Will you tell me about this and show me what you do?" And then here's the deal. For the next month, I would like to watch how this plays out. And then would you be open to us meeting again, and I can offer some suggestions on things that I find, that might be helpful to the process? I love your process. I think it's great. But, I might have some ideas as well that I could share. And I'm new, so
Mhm.
sometimes fresh ideas are good, but I'm going to take a month. I'm not going to jump into this and change everything up right away. I'm going to take a month and see how things go. And I want to learn from you just as much as you're going to learn from me. Would that be okay? How can anybody on the planet Earth argue with that? Right? That shuts that "we've always done
Mhm.
it this way" kind of business down. I think it's been helpful in my past. Yeah. What do you think, Vanessa?
Yeah, I agree. When I had joined my practice, and I use this as an example many times, um, the manager, when I had assumed that one of the docs had left and I had to absorb a lot of her patients,
Mhm.
and she had done a tremendous amount of narcotics and controlled substances without having patients coming in. And so patients would say, "Well,
Oh.
Dr. So and so
Ooh.
never did it that way." And I finally said to my manager, "Listen, I will give them 30 days of a refill, but they either need to come in or they're going to
Yeah.
psych. But I'm
Yep.
not going to continue to refill these medications. It's my license."
No.
Mhm.
And I would
Yeah.
hear her on the phone and she would say, "I know that that's how Dr. So and so did it, but,
Mm.
we now have a new provider." And the patient would give them whatever lip they would say. And I would hear her say, "Listen, there's a new sheriff in town. So we
I
have
love it. I love it.
we're gonna be changing things, and
That's
I'm
right.
just gonna tell you she's not gonna be the same way the other doc did. So you have two decisions here. You can either stay with her and work with her, or you can find another provider and she'll give you refills for 30 days."
Wow.
And that was pretty much what we had to do, because we've always done it this way
Oh,
adage doesn't always apply. And
no.
sometimes I find that when I've been told that at other practices, "Well, we've always done it this way," it's out of sheer laziness that they don't want to change their ways.
Mhm.
And, you come in as a new grad, you're idealistic, you've got some great ideas, but you also don't want to start off on the wrong foot
Mhm.
by coming in. Like you said, Jason, you don't want to come in and trying to change things overnight. So just kind of taking that back seat, watching how
Yeah.
they do things, and then start to slowly integrate some of the
Mhm.
changes
Mhm.
in a way that doesn't feel threatening to your staff.
Absolutely.
Definitely.
Right. So the other thing you have to also consider too, and we've talked about the dreaded inbox, but who owns the messages? Who's in charge of the refills? Who's in charge of the folder of all the forms that we have to fill out? I don't know if you all have
The
the
folder.
know your numbers. Do you have the know your numbers for employees?
No, I
No.
don't.
So we
Tell us. What is that?
Yeah, so we have something that's called Know Your Numbers, and it's part of the healthcare that the hospital offers. So the employees that work for our health system that see me, they have something that's called Know Your Numbers, and they have to know what their BMI is, their
Oh,
waist
okay.
circumference, their lipid panel, their blood sugar, their A1C if it's applicable, when their last eye exam was, when their last pelvic exam was, or Pap test was, or mammogram,
Mhm.
and it really is a way to help patients become and employees
Hmm.
start to really own their own healthcare and be
Mhm.
much more engaged in their healthcare. So what they do is they actually get money back
Oh,
when they do the Know Your Numbers.
Oh, wow.
But
nice.
as a result, we have a
Oh, yeah.
file
Yeah.
that you have to fill all this paperwork out.
Mhm.
Most of the patients do a pretty great job because when the
Mhm.
numbers come back, what they do is they fill their part out. They'll actually put all the numbers in there. So I just have to verify it online. It takes me less time.
Mhm.
But the forms, we all know the back to school forms,
Mhm.
any of
Mhm.
the, I don't know if any of you, the daycare forms when they have to, every year they have to have a physical and have a PPD done and,
Mhm.
that kind of thing. And so, and
Yeah.
there's always a myriad of forms that we have to fill out. So who owns those? And that's
Mhm.
always part of what the delineation and what the job descriptions will tell you who is going to be in charge of all of that. But also, too, you have to think about your deadlines because many times as we're getting ready to go back to school, I'll get a lot of teachers and students that come in and they need to have their form done that
Mhm.
day. And we
Yep.
always have to say to them, listen, it takes 7 days. I have a stack of other forms on my desk that came in before you. So no, I can't fill this out today
Mhm.
because they want you
Mhm.
to do it right then and there. Like, well, I have to hand this in tomorrow.
Mhm.
Guess what? It's not going to get done until, a week from now because again, there's probably 20 people ahead of you waiting for their forms.
Right.
Mhm.
I mean, I do try to honor that and fill the forms out, but it's really nice if you have a nurse that is able to fill those things out and you just have to review it and sign it.
Yeah.
Mhm.
Well, what I have found on that issue too is, sometimes you can look at things with fresh eyes and actually make the people's lives that you work with better and easier and more
Right.
workflow, more streamlined. At the VA, when I first started at the VA, and I've been there for over 10 years, so these providers are no longer there, they've retired. But when I came into the VA, I came in after working at the emergency department, and I was used to entering my own orders in the EHR. If I wanted labs or something, I would enter the order myself and sign it, right? So it's done right away. And so I was used to that. So I come to the VA and I'm like, okay, I'll enter my own orders in for labs and return to clinic visit and any special consults or anything like that that I would have to order that I wanted to order for the patient. And this provider told me, oh no, we don't do that. You just tell your nurse, right? The nurse that we have the honor to work with is how that should be said always. And so if you catch yourself, I catch myself saying your nurse sometimes too. All of us do. But the wonderful nurse that we work with, that's their job. You just come out of the room and you tell them, I want this and I want this and I want this. And they're writing it down, right? And then they'll go enter it in my mind, I'm like, well, that's just crazy work because you're duplicating work. Why don't you just enter it in yourself? It takes the
Mhm.
same amount of time and the burden off your staff. So
Right.
sometimes a fresh approach, they will love you for it.
Mhm.
So bring those ideas. Yeah, I like that. And knowing each other's roles and responsibilities.
hmm So, Christopher, how do you feel about the unlicensed personnel, those people who are answering the phones, triaging, and giving medical advice before it even reaches your inbox?
That's very frustrating, actually, especially because, as we talked about before, it's always your license on the line. The buck stops
Mhm.
with you.
hmm
So if you have these unlicensed personnel that are giving medical advice, then they're putting your patients at risk. Bottom line, they're putting your patients at
hmm
risk. So I remember when I was a nurse, there was another nurse that I was working with, and she was talking with one of the patient's family members, and she was talking about a specific medication. I believe it was Percocet, but the information that she had given them was completely wrong. And this
Mhm.
was actually licensed personnel. So uh, kind of going back to the unlicensed personnel, if you have licensed people that are giving them wrong information, then the unlicensed personnel are giving them or have the potential to be giving them even more wrong information.
Mhm.
So they really should, if they have medical questions, they shouldn't be fielding them. They should be saying,
Yeah.
"Hey, you really need to talk to your provider about that. You need to talk to the RN about that. You need to talk to the medical assistant, LPN, what
And
have you."
how easy is that scripting right there,
Yep.
right? Yeah, I
Right.
don't have
Right
the
there.
answer, but let's get it for you. I'll
Yep.
have you talk to them.
Mhm.
Yeah.
Yeah.
But, also we've talked about this in past episodes, Jason, the daily huddle. Don't
Yeah,
you find that the daily huddle is so vital to start the day off on the right foot and
100%.
look at the patients that are on the schedule to say, this one needs an EKG, this one's going to need blood work, this one's probably going to be late, this one's not going to know their medications, but at least it prepares our team for what's going to lie ahead for the day. Right. I mean, I love the daily huddle, and I think that it's really important because it really does help to, shift the priorities and, look to see what's going to be happening for the day and help it to streamline a little bit.
Yeah.
I
So,
agree. And without that, don't you find the days that you don't do that, the days tend to be a
frenetic.
disaster? Oh, yeah.
Yeah.
Out of control.
exactly.
Yes.
The other thing I found this too,
exactly.
let's say you chase your dog down the street, you drop your $10 cup of coffee as you're going into the clinic that day and life sucks for you, and you go in there with a shitty attitude, right? All of us have done that. We're human beings. But you need to reset at the huddle, right? Before you do the huddle, because if you go in there with a crappy attitude, the whole day is shot and everybody's pissed off at each other and nothing's working right. And that's so hard to do sometimes because we're human beings and crap happens to us, right? But I would say check your attitude because you choose a lot of times to have a bad attitude or not. So I would recommend that too.
What I recommend is
I
going
feel
into
like
the
you
patient
just
room.
described. Oh, sorry.
What I recommend is going into the patient room, screaming really loudly, closing the doors first, screaming really loudly, then going to your huddle.
Oh, there you
Find it
go.
very,
That would work. That would work. Yes, yes. Vanessa, what were you going to
Except
say?
if your walls are paper thin, that won't work, Christopher.
Not good. Somebody call
But
somebody.
Jason, you were just describing exactly what happened to me last week. I was getting ready for work and I was pouring my iced coffee into my container in the glass jar. I hit it against the my concrete. It's not concrete. Take two. I hit it on the
Formica?
This is great for a
Nope.
blooper reel.
granite.
All
Blah.
of us.
Okay, let's try that
Granite.
again. You described exactly what happened to me last week. I was getting ready
Yeah.
for work and I was pouring my iced coffee and I hit the glass container onto the top, my cabinet top,
Ugh.
and it was full and the entire glass shattered everywhere. I got
no.
coffee all over me.
Oh, no.
And now I'm running late. Now I have to go upstairs. I've got to change my scrubs. I've got to wash the coffee off because it went right through my scrubs. I smelled like coffee all day, even though I think it was probably just in my nose. I'm trying to race to work. And of course, don't you know, there's an accident on the highway. Now I'm going to be late.
Of course.
And by the time I rolled in the door, I was not in a good place, but I had to check myself. And did I mention it happened to be the day that my brand new medical assistant was starting?
Oh, not
Oh, good
perfect.
times.
Perfect
Yes.
timing. What did she
So,
walk into?
Yeah, it was perfect timing. So I didn't want to start it off I didn't want to scare her and she'd say, why did I take this job?
Damn.
So I just said to her, just give me 5 minutes. I told her what had happened and she said, not to worry. I'll come back in 5 minutes and we'll huddle. I'm going to go get the first patient ready. And she was great about
That
it.
is perfect.
But you're right. You have to check yourself and you need to, really take a look at yourself and then have that huddle so you can reset your whole day.
Definitely.
You do.
So let's take a look at how do you delegate without turning your teamwork into what we call a task dumping. Jason.
Wow. Number one, I would say that when you're delegating, never ever use the language, I don't have time for this, so you need to do this when you're checking a patient or whatever, right? Because the people you work with, the amazing nurse, LPN, medical technician, whoever it is, right, is working with you, they don't have the time either. And they will take that as a big insult, like, well, screw you because I don't have the time either. I'm busting my butt here. And so I always say, would you mind doing this for me? When you're checking the patient, do the visual acuity exam on the Snellen and eye chart, or, make sure you calculate out their BMI for me, or whatever you need. Do it very kindly and say, because while you're doing that, I'm going to work on blank, blank, blank. So they know you're just not sitting around and having them do all the work. I find that how we talk to each other is so important, so important.
I think one of the important things is when you're asking people to do those jobs, one thing is to mention is, don't say it's not my job or that's not my job.
Right.
I think if you're delegating a responsibility to another team member, then you should be well aware that you yourself can do that job. Or should be able to do that job.
Yeah.
So I think that's really important too.
Although I have to say, as an RN, I worked in a hospital once that I went to empty the garbage can on night shift, and an RN came up to me and said, "Oh, we don't do that. Only the LPNs do that." It's like, are you kidding
No.
me? Are you kidding me? You are not nurse of the year, right? Yeah. It's like, well, I'm going to do it
Right.
anyway. I'm going to empty all the garbages, right? Yeah. But their fear was that we would have to empty the garbage every night. It's like, come on, be a nice human being, help each other out, right? What do you guys think about the hierarchy, like RNs and LPNs and medical technicians? I hate when there's this hierarchy that there's a lot of conflict, like, oh, you're an RN, so you're so good, and the LPNs kind of get sidelined or the med techs. The way I look at the team members is everybody is equal in their importance and they're vital to the team and success and good outcomes with our patients. We just have different roles, you know? And we're nurses as NPs, we're nurses, right? Sometimes we forget that. But what do y'all think about that? Do you see that out there? I have seen that and I don't feel good about it.
I do see that. And it's interesting because I had the reverse happen to me. My medical assistant was busy doing something else. And I went in and one of my exam rooms hadn't been cleaned. So all I did was I just took the paper, put the gown into the hamper and I started cleaning. And she came in, she said, "What are you doing?" And I said, "I'm cleaning the room." She said, "That's not your job. That's my job." And I
Oh,
said,
wow.
"No, we work together as a team here. And when you're tied up,
Yeah.
I'm going to clean the room like this is not a big
Right.
deal."
Oh, yeah.
So
Yeah.
we
I love
really
that.
have to look that delegation is really not like a blanket permission. Delegation really is very specific
Yeah.
to different things so that they don't say, "Well, she gave me permission the last time to do this, so I'm just going to do it now." They need to know that when I'm delegating something, it's going to be for this particular thing, but it doesn't mean
Yeah.
that it's going to happen all the time. Do you find that as well?
I do. I do. I absolutely do. Chris, you?
Yeah, I think it's really important because, like you said, Vanessa, when you're delegating that responsibility in that instance, it's just for that instance.
Mm-hmm.
And if you give them the carte blanche to do it all the time, you may be, putting yourself at risk as a licensed professional,
Well,
especially as the
Right.
NP.
and the other thing I've run into too is, and this is fairly recent, I don't know, in the last year and a half, I have had the wonderful honor of working with a new LPN that I get to work with, not have to work with, but get to work with, and she is absolutely amazing. I would argue she's the best LPN in our entire clinic, but Christopher might disagree with
I
that.
disagree.
Yeah.
I'm saying.
Thankfully, we're a hallway away. But in that case, let me share this with you. She would go into the room and room the patient and do vital signs and get history and all that stuff. But it was taking a little longer than I was used to, with working with other staff. And so she would come out and she'd give me this big, long diatribe of information on the patient, stuff I was going to ask the patient anyway about their health and history and why they're there and doing a deep dive on all their health issues. And I asked her once, I really don't need all this information because I'm going to ask them this anyway. You work so hard and, we get behind in things. You're already working so hard. I can do some of this and it's my job to do some of this. Well, perspective is everything. She told me, you know what? That is such a relief. Thank you so much because I worked with a cardiologist
Oh no.
that expected me to get the entire history, what the patient's there for, every single detail about every health issue and report to him. And if I didn't, he would get very angry. And then he'd go in the room for like 5 seconds, right? So perspective's everything. Who you're working with maybe worked for a complete bozo before, right? And so they're terrified or they don't know what to do. So just open communication from day one. Yeah. And don't assume anything because I just assumed in that case, well, maybe this is just the way they do things here or the way she does things. When in fact, it was all based on that horrible, horrible experience. Christopher, have you seen that?
I haven't, but I'm blessed to work with an LPN that has been there. She's been in the clinic for, I want to say 6 or 7 years now. So she's really has a solid foundation there. She knows the process. So when we work together, the process is rather seamless. So I don't have to really worry about that so much.
Yeah. Have either of you, this is a question, have either of you worked as an RN in a outpatient clinic?
I did.
I filled in once and I could not get out of there soon enough. Oh my gosh. They are amazing. They're incredible at what they do because it takes a specialist person with lots of different skills that I didn't have at the time. So yeah, I really appreciate the work they do.
So, just the bottom line is that those of us who have to delegate, we have to be accountable for the decision. And ultimately, it is our license. And those that we delegate to, they are accountable for whatever it is that we're telling them that they need to do. So we have to make sure that they understand the nature of being delegated to and that they're not It's not that we're bossing them around, but we're giving them things that are really, let's face it, they're hired to make our jobs go smoother and easier during the day.
Yeah.
So again, it's all in your verbiage and all how you approach it with people. But when you state your expectations about, I need you to do this, or I'm going to ask you to take care of this particular thing. Let's say it's a prior authorization. So I need you to, this is your priority to do this prior authorization to get this patient's MRI. The patient needs to have this MRI within the next 24 hours.
Yeah.
Here's all the documentation that you need for the insurance company. And this is what I need you to look at. And so I'm giving them to tell them, I'm giving them the deadline. I
Yep.
want them to know it's got to be done. The patient's going to be having it in 24 hours. Here's the information you need. It's all in my note here. You just need to tell the insurance company exactly what's in my note here. And then if there's a problem, then you can get me out of the room. But at least this way they know that here's your task. This is what you need to do. And then if you are not able to get it done, then I will have to get on the phone. But again, we have to hold them
Yeah.
as accountable
Totally.
Yeah.
for whatever task, as just like we're being held accountable.
On
Right?
that topic at the VA, what I do, especially for important things that just cannot be missed that I'm delegating to them, I'll finish my progress note. And let's say I need to refer a patient to a specialist, or I receive test results that I want the specialist to see, or the patient has to get an appointment with a specialist like urgently or within a few days. And I want the LPN that I work with to handle that and get all that arranged, or fax those labs or those study results to the specialist so they can see it. I'll document all that in my progress note. I'll sign my progress note. And then what I do, because our system allows this, I don't know if every EHR allows this, but at the VA it does. We can do an addendum to our note that shows right at the top of the EHR, like the most recent note. And I'll do a little addendum and I'll type in there packed LPN or packed RN so they know right there that it's for them. And I'll put in there, please fax these labs to this office and call their office to alert them of the incoming fax. Speak with the nurse, not the receptionist, because the receptionist has a whole other role and responsibility. They don't have the clinical knowledge to know it's important. And then at the end of that, I'll put, please document that this was done. And then she'll actually enter a note in there and I sign it. And then I also assign her so it shows up in her inbox. And that system has worked great for us because otherwise, I've had them say to me occasionally, gosh, did you enter that addendum? Because I'm going to miss that if I don't see it because that's part of our system. So just having a system down. But I would say on those important things, document well. Because when things bad happen, it's going to turn into, well, I didn't know, or they didn't say that, or, yeah.
And most of the electronic health systems, and I'm not sure which one all of you work on, but most of them will actually have the ability or a tab to close that loop like you just talked about. But let's say that, I have a patient that needs to go back and have, a mammogram in 3 months as a follow-up. I can actually put that in so then it comes up as a reminder
Nice.
2 weeks before
Yeah, we have
if
that
the
too.
patient hasn't made their appointment. So those are the things that you can do because, again, it's a liability for us. It's all falls on us as the licensed people. So having that closed loop communication is going to be so important.
You have
Again,
to.
to make sure everything has been documented. Do you all use the SBAR, the Situation Background Assessment and Recommendation?
No, tell us more
SBAR?
about that. Yeah.
So our hospital system adopted SBAR many, many years ago, and it's across the board. It's not just for medical, but they actually use SBAR for if there's something going on with our electronic health records and there's a problem and something's been reported, they'll send an SBAR communication to our emails just explaining that, electronic health system was out, or like Duo. Duo is our two-step system that we use for prescribing scheduled medications. You have to actually get it on your phone before, and that you have to do the two-step approval. Well, there was an issue with it a couple of weeks ago, and we reported it. I said, I can't get into my Duo here. It's not accepting it. And I kept restarting my phone. I'd restart my computer. And what I did was I reported it. I apparently wasn't the only one. They sent out an SBAR. So it's really good for when you have like an urgent update and you want to close the loop on a particular problem. But the SBAR is something that a lot of people tend to use.
I love that.
How about like the delegation when you're delegating, helping our support staff to understand red flags, like things that we need like an immediate interruption, come get me in the room, that kind of thing. How do you all deal with the red flags or like a critical result with a patient?
I think the huddle in the morning is so important because if you as a provider know that you're awaiting labs that have the potential to be critical labs. Discussing that with whoever, in our case, RNs and LPNs, in your case, Vanessa, discussing it with your, your medical assistant, saying, hey, I keep an eye out for these labs. If there's critical values, I need to know immediately. You need to interrupt me, what have you, just so I can have those labs at hand, and then develop your plan of care, whatever that may be.
I agree. And that's what I do too. And from day one, I'd recommend that new NPs out there going into a practice, even during your job interview, ask administration, how do you handle intra-office emergencies and whose role is to do what during those emergencies? Because often we're the lead medically, right? Yeah, from that standpoint when we're seeing a patient, but to know the different roles, because if you have an emergency, that is not the time to decide whose role is to do what, but
absolutely.
Yeah, so
you want to have that up front.
Oh, yeah.
So on that note about delegation, how, as a new nurse practitioner, would you encourage new nurse practitioners how they can coach their support staff without coming off as being a micromanager? Christopher.
I figured you'd ask me.
Are you?
I can redo that and ask Jason if you want.
No, that's fine.
Okay.
Not to beat a dead horse here, but again, it goes back to that communication, that clear expectations. But have that conversation with them. If you need something done, just say, have that conversation. Say this is really important. It needs to be done, and and try not to hover over them.
Yeah.
You can check in with them later on in the day or what have you, but try not to hover over them and check in with them every 2 minutes or 3 minutes or what have you. I mean, if it's important, it should be done at that moment. They shouldn't have to wait for it. But if it's something that can wait, then check in with them later in the day.
Yeah.
They have jobs too. They have roles too and things that they need and tasks that they need to get done at that moment.
Yeah. And I would say for me, what I'd recommend our listeners and friends out there should do is, and it comes back to kind of summarize some of the points already made during this episode earlier, but on day one, when you go into work, go in there with a good attitude like we talked about earlier, and tell your staff from day one, you know what, I'm just going to hang out here for a month. That's another key thing we talked about. I'm going to hang out here, just kind of observe and learn from all of you for about a month before I share any ideas on what I think would work well with this or that we can add. And go in there with a good attitude, go in there as the leader, lots of confidence. Because if you don't have confidence when you walk in there, they pick up on that.
Yep.
And that could be a disaster for you. So make sure you walk in as a leader, but not a dictator. You also want to be nice. So find a balance there. I worked with one NP that just had a God complex from day one when she started, and people didn't like her very much. And if people don't like you, they're not going to come to you. They're going to be afraid of you, right? Yeah. So go in there with a good attitude. Tell folks, I'm not going to change anything. I'm going to seek to understand before I seek to be understood. I love that quote. Seek to understand before seeking to be understood. And so go in there with a great attitude and just work well with your team from day one, though, because they'll pick up on it and that'll set the pace for the rest of your career in that setting.
I think too, as we're getting to know our teams, that micromanaging aspects tends to fade away. If you're new on the team and you're just starting with a team and you don't know necessarily, you don't have that trust built with the team yet. I think once you develop that trust with the team and you know that they know their roles, they know their responsibilities, and they're able to get the job done for you, I think that micromanaging aspect tends to go away on its own.
Well, and there will be days as human beings that we are, that we're going to screw up, that we're going to say something wrong that irritates the crap out of somebody else or is frankly rude to a teammate and a coworker. That's going to happen throughout our career, right? Because we're human beings, we make mistakes. But I would say apologize early. Don't let things fester, right? Don't let things fester. I did that. I can admit my faults, right? I mean, we talked about that our first episode. We're going to give you how it is, right? Tell the truth on this stuff. But I did have a disagreement with one of our staff members. I was completely inappropriate, completely wrong. And I didn't let it wait, though. The very next day, she loves plants. And the very next day, I turned her desk into Jurassic freaking Park, right? With a big note, an apology letter, and I think some chocolates too. But that's not enough. That's not enough. You got to eat your pride, go in there and say, you know what? I really screwed up and I'm sorry. That's how you make a connection, because these people you're going to work with, you're going to spend more time with them than you spend with your family, right? They become your second family, so yeah, be quick to apologize and mean it and be sincere about it. Christopher,
and when you train, I'm sorry.
I was going to ask Christopher if he ever messes up like that.
Yes, I have.
You have. And what have you done to rectify it?
Um, funny, it's similar to what you
Did this happen
did.
today? Did
No,
this happen today?
no, this was
No?
this was a while ago now. But the next day, the person had a card on their desk, and they happened to like love pink starbursts, so they had a bag
Oh,
of
nice.
pink
But it
starbursts on
Oh,
doesn't
their
take
that's
desk,
much.
awful.
and a conversation.
Yeah.
You
Yeah.
know, like you said, that open communication and just saying, I realize I messed up. I apologize.
Yeah.
And then you can continue to build the relationship moving
Yeah.
forward.
And go from there. And if you
Right.
don't, it festers. Vanessa, how about you? How do you make up to somebody that you really
I probably don't do Jurassic Park, but I've done exactly what Christopher has done,
Nice.
and I just, I just appeal to them and say, we have to work together. I'm not your boss. We work as a team, and I'm sorry, and we all have our
Right.
Mhm.
bad days at different times, and I hope that we can move forward from this. And I've never had a medical assistant that didn't. I mean, fortunately, those are few and far
Yeah.
between, but I've
Mhm.
never
Right.
had any of my assistants that didn't say, "Yeah, I get it," because Lord knows they have bad days as well.
Mhm.
So,
Well, and you
um,
will know, don't you find too, when the longer you work with somebody, and this is really important for our new NPs out there that are walking into these situations, eventually, and if you're not doing this and being very curious about your teammates you're working with, because they truly become your second family and you spend a lot of time
mhm,
with them, but spend some time pick up on the small things like the nuances, like the
right,
wonderful register nurse that I get to work with. I love this person. I truly do. She's amazing at what she does. She's been doing it for years. She's so talented and skillful and just a good human being. But she also tells me, you know what? If I have a grumpy face before 10 a.m., don't talk to me a lot. But after 10 a.m., it's fine. Right. But understanding those nuances that, because all of
right,
us are humans and
Mhm.
we want to find out what buttons set people off so we don't push them. Take some time and be
exactly.
curious or even ask people directly, what buttons do you have that I don't want to push? Definitely don't want to push. Have you done that, Christopher, with your team?
I don't. Well, I think that kind of comes naturally
Yeah.
with when you're
Yeah.
building that
Right.
relationship with the
As a
team. 'Cause
human being.
And as you're building that relationship with the team, you're going to start to notice those nuances that you were
Yeah. Yeah.
suggesting, and the things that the triggers that you can potentially trip with certain people, and avoid tripping those triggers, and avoid the things that are going to
Hmm.
potentially make another team member mad.
Yeah, yeah. Otherwise, you're buying Starburst and
Exactly.
turning people's desks into Jurassic Park all the time,
Exactly.
right?
Exactly.
But
Right,
and then letting your
right,
buttons let them know about your buttons too, like and it doesn't have to be some heavy conversation. It could be, "You know what? This absolutely drives me bananas when people do this." They'll get a hint. And
Yeah.
then if things continue,
right,
obviously it becomes more serious, but
Mhm.
right. So, how about competency validation? If you're teaching your staff a new particular type of skill that you're going to be delegating to them, do you do competency validation at all?
not for the staff that we work with. For each other we do.
Yeah.
For each other, but
Right.
no. Yeah,
Okay.
because it's pretty stovepiped at the VA. They go to their leadership and,
Hmm.
for all that, but
Yeah. And I know that they
So,
have a competency checklist that they have
yeah.
to that they have to
right.
follow. So when there's a new procedure that comes
Mhm.
out for the nursing staff, they have to the the clinic manager has to check in with them, and they have to check
Yeah.
off on, a list basically saying, yes, I'm competent in this, and somebody has to sign off on it.
And we can be part of that process depending on your organization. I would say new NPs out there, find out what your organization does because that might be a big part of your
Exactly.
job. Is it a part of your job, Vanessa?
So it's more part of our lead MA or our office supervisor.
Mhm.
But it is part. I mean, I do have to sign off on
Yeah.
a couple of different things. But we do a lot of teach backs, so we're very close in that we make sure that they feel comfortable before they
Mhm.
have to start doing something on their own. So it's not just a do one, see one, teach one,
Yeah.
or see one, do one, teach one. But it's more, how comfortable are you? So, for example, in Connecticut, they passed a law a few years ago that medical assistants can start to give injections now.
Mhm.
Hmm.
So they can give vaccinations and that kind of thing. And, I will be the first one to tell you that I was not in favor of medical assistants being able to do that because I don't think that their
Yeah.
education prepares them the way a nurse does.
Hmm.
Mhm.
So, but what they did do was they took all of our concerns because many of us have our faculty at different universities. So we're coming from a very RN centric background. And what we ended up doing was they came up with a couple of lead people who are stellar medical assistants, and they have a whole program that they have to go through. They do need to become certified, so they have to go through the process, and then they have to go through this whole checklist in order to get validated. But
Wow.
again, I had somebody, so the other day I was running a little behind, and one of my
Mhm.
patients wanted I don't know, a pneumonia vaccine or a Tdap or something. And so I said to one of our senior MAs, who is on the clinical ladder, you have to be an MA2 in order to be able to give injections. And I said, I know that you've been thinking about doing these again. I've got an injection. And she said, I need to see some. And I said, well, then come in the
Mhm.
room and we're going to get you
Yeah.
comfortable with this. But
Mhm.
I know you want to go through the training again, but you can't avoid doing this. This is part of your job.
Hmm.
And, we need to just jump in. So what can
Mhm.
I do to support you? And having that training and that
So
validation and
good.
that teach back was really helpful for her.
It sounds
Awesome.
like it.
Yeah.
It sounds like it, and using
Yeah.
every opportunity, right? How about the
Right.
time when you have somebody come up to you and say, I got this list of skills I need you to sign off on. Would you mind going through this? And you're busy, you don't have time, you just wing it and sign away, initial away, check
Nope.
boxes.
Nope.
Never,
Nope.
ever, ever,
Nope.
ever do that, because you know what? If something
No.
happens, those lawyers are going to have a heyday, an
Yeah.
absolute heyday with
Mhm.
that. So, yeah, yeah. I love our discussion. This is so good. Yeah.
Yeah. So, we have some resources to share with you, and these are going to be in your show notes as well. And the first one is the National Council of State Boards of Nursing. There's a web address for that. The Agency on Healthcare Research and Quality Team Steps, and also the American Association of Medical Assistants. They have state scope laws. So make sure that you
Mhm.
familiarize yourself with what the laws are in your particular state when you start to practice if you're going to be working with a medical assistant. So now we get into our favorite part of the program, which is our fact or fiction. Still waiting for the confetti and the
My
prizes
goodness.
to come
Where
down.
is it?
And the
Where
music.
is
Don't
it?
forget the music.
Where is
And the
it?
music,
Where
yes.
is it?
All right. So, Christopher, a job description alone provides a task is safe to delegate, or proves a
Absolutely.
task is safe to delegate. Is that fact or fiction?
Absolutely not. That is pure fiction. Because
Absolutely.
you can have a job description and somebody you're trying to delegate to that can't even accomplish that job description.
Yeah.
So
Mhm.
Yeah.
Right. Exactly. All right, Jason, the 5 rights include the right task, circumstance, person, directions, and communication, supervision, and evaluation. Fact or fiction?
I would say fact.
Yes, absolutely.
Absolutely. Yep.
Just like
Yeah.
when we used to do the 5 rights of, before we give
Yeah.
a medication to a
communication. Yep.
patient, it's the same thing.
So
Yeah,
good. And that'll be in our show notes for folks out there that
right.
didn't know that. So yeah, take a look at that.
Exactly. All right, Christopher, closed loop communication confirms that a message was received and correctly understood. Fact or fiction?
Absolute fact.
Absolutely. Yeah. And we need that because, again, our licenses are on the line, and
Hmm.
closing that loop and everything is documented and
Hmm.
documented clearly.
Here's a
All right. And
question
last
for
one
you.
is,
Here's a
Hmm?
question on
Go
that.
ahead.
How do we do closed loop communication, which is effective with our kids? You need to clean your bedroom, close the loop. Did you clean your bedroom yet? I feel like a broken record. Any ideas on that? Or is that a different podcast?
That's a different part.
I think that's a different podcast.
All right.
Parenting is not part of this.
Dang it. Next time.
All right. Well, this one's for you, Jason. After delegating, the NP no longer needs to supervise or evaluate the outcome. Fact or
Oh, you
fiction?
bet. Yeah, go with it and lose your license soon,
Mhm.
right? Yeah, yeah. Absolute
Right.
fiction.
Mhm.
Yeah.
Absolutely. All right. So, everyone, we appreciate you so much for tuning in and listening to our podcast. And we want to share some special savings with you. If you visit FHEA.com and use the code LAUNCHPAD20, you'll get an additional 20% off our continuing ed library and our memberships. And we have a huge library of a variety of topics. I dare say there's probably not a topic on there that you can't find in
Yeah.
our library. But Launchpad 20 for 20% off in our way of thanking you for supporting our show. Now I'm going to move into our mailbag. You can email your questions. You never know, we might use it on a future
Yeah.
podcast
Mhm.
at nplaunchpad@fhea.com. That's nplaunchpad@fhea.com. So we have a couple questions here. Christopher, which recurring task creates the most confusion about ownership? Any ideas?
Wow. That's kind of a tough one.
Which
That's a hard one.
Yeah, because there's so much. Yeah.
which recurring? Could you repeat the question?
Which recurring task creates the most confusion about ownership? So, in other words, what does our support staff do where there might be a gray area as to
Mhm.
who is responsible for the results or the outcome of that task?
I'm going to feel this to Jason, actually.
Oh, that is no fair. No fair. My goodness. When I think of tasks, I would say, gosh, when things get busy, it's great to have these plans in place, right? You should do this and this and this. But when things get busy, those plans tend to go to the side and things get missed, right? So to have to reinforce that, no, this needs to be done every single time. Like, with annual visits, make sure the visual acuity test is done for me, those kind of things. And that does require some massaging and reminders, and you might find yourself getting frustrated. But again, choose your attitude and work through that with your team, and lots of reminders. And I would say the biggest benefit when you're faced with those things where things are not getting done, but you really need them done, is clear, open, honest communication and to be kind. How's that?
Always be kind.
How's that? Was that a good answer?
That was a great answer.
All right.
I use my phone a friend.
Point for me.
All right. Which one of you wants to take the next one? What red flags should your staff know means interrupt me now?
Actually, that's a really good question.
I love
we touched on it earlier. When you have those critical lab values that are coming back, or you have an imaging study that's coming back, something that you need to know, right then and there, have that conversation in morning huddle and say, these imaging studies, these labs, these results should be coming back today. And even if I'm with a patient, you need to interrupt me, and we need to close that loop.
Yeah, and something not as emergent as that, but so important. Let me share this with our audience, that let's say you're ordering an MRI on a patient, or let's say this. Let's say the registered nurse you're working with comes up and says, yeah, the specialist recommended we put in this test. Let's say it's an MRI. Always do this. You always have to close the loop on these big tests. Oh, yeah, would you mind go ahead and ordering that? And then they order to sign, and we sign the order, but you have a million orders to sign. So you're looking through them, but you might miss something. So they put the order in, but there's no follow-up. No return a call to a patient to review the results, any of that. So what I've told the RN I work with, whenever you enter an order like that in for me to sign, please always pair it up with a return to clinic phone visit. So I never, ever miss that. That's my system, but you have to have a system in place. So adding those little nuanced things like, yes, you can enter this order in, but this is so important that I also need a return to clinic order through a phone visit. So that's an example of something not emergent or a red flag, but so important that it's not missed. So you have to have a system in place and open communication.
Absolutely. The RN I work with actually takes when they get the results from the imaging studies back, I have a folder on my desk that is for provider review. And I go in there, I review the imaging studies, review the results, what have you, and then, respond to the patient with the information.
It's good. Yeah.
Nice. Good. All right, so here's your wrap-up landing checklist, everyone. For our new nurse practitioners, you want to create a one-page role and task matrix. This will really help you guide you into what the expectations would be for a particular delegation, and depending on who you're delegating to. And write your escalation triggers for any routine, urgent, and emergency concerns. Having them written down, again, in a place where other people can access it will make sure that everybody's not literally on the same page. And then audit one workflow using the 5 rights and closed loop completion. That's your landing checklist.
Yeah.
And your homework for next week is, again, to audit that one workflow, but define the owner, the deadline, your escalation rules, and the proof of completion. And this will just help you to prepare you on what it means to have closing those loops and what you do in terms of workflow and who is responsible for what. So that's your homework for the next week. All right, so I want to thank everybody again for joining us. If you wouldn't mind, we would love it if you would drop us 5 stars, hit follow, tap subscribe, and most importantly, please share this with anyone else you know, with your friends, your colleagues, somebody that may be thinking about becoming a nurse practitioner. And we just appreciate you showing up for us and being part of this amazing podcast. So I want to say thank you to everyone. Guys, do you have anything you want to wrap up with?
No, take care, everyone. Yeah, great episode.
Y'all have a good week. Take care.
Great.
We'll
see you next time, everyone.
See ya.
Thank you.
Take care.
Bye now.
You've been listening to NP Launchpad, presented by Fitzgerald Health Education Associates. Like, subscribe, and share. And for more tools to power your NP career, visit FHEA.com.